Welcome to the very first episode of Occult Awareness, a podcast dedicated to uncover the hidden narratives and overlooked challenges within the world of rare and underdiagnosed medical conditions. I'm your host, Amy Wang-Hiller, and today I'm not just here behind the microphone, but I'm also telling you my own journey. My story, like many of yours, is one of those perseverance through uncertainty. It began with symptoms that don't really fit as usual patterns, symptoms that were easily dismissed but impossible to really ignore. As we embark on this journey together, this podcast will serve as a platform for all those who have navigated similar paths and those who have struggled not only with their own health but also being heard and understood by the medical community. Today, we will dive into what it means to live with an occult condition, and we'll explore the emotional and physical complexities of seeking a diagnosis when the doctors didn't even understand, and the isolation that we felt emotionally, and not really having a name for the condition that you have, and wanting that relief of knowing what's going on, with challenges every single day, with the symptoms, with medical experts, conversations with those who have walked this road, and insights from healthcare advocates. Our mission to foster understanding, advocate for better diagnostic processes, and build a community that where no one needs to really navigate the unknown alone. And join me as we take the first step together and in bringing you the occult to light. Today's stories is just the beginning. The term occult, from the Latin word occultus, meaning hidden or secret, and it refers to something that is not immediately observable, a process that's really there, not visible, like occult bleeding, which is hidden from the eyesight but critical to really detect for diagnosis and treatment. And we will explore the evolution of word occult as some place that really giving the meaning of witchcraft or mystical beings. But right now we are really talking about daily lives with the occult conditions that really cannot be detected for the current science and current knowledge of the medical community. All right, let's talk about what's going on with me. So I haven't been on YouTube for quite a while, since 2020. I know I've showed up like for 3 months, really intensive filming and the burnout about filming Steady With Me, and I was blonde. Well, now I look like I'm still blondie. But I actually got a buzz cut, as some of you might follow my journey and saw my recent just short film on YouTube that I returned to the dark hair, and then recently I got a surgery, so I become bald. And yeah, so let's talk about really what happened through this 3 years of progression. Right now, I am considered as a C1 incomplete quadriplegic. I don't really have much of hand movement. With my power wheelchair presents my ventilator with a mouthpiece that gives me a big puff into my lung so I can breathe, because my diaphragm also doesn't work. Crazy enough, I made this giant map for what exactly going on since almost 2013. This is the bigger version. It was event after event. It was definitely triggers that caused sudden onset of loss of certain movements. It was scary. I often was told that was just psychological, or they use psychosomatic. So let's start from the very beginning. As I kind of disappeared on internet for a while after 2020 when I went to a float tank. So before that, I definitely had a lot of symptoms, but really this is when things really went downhill. I want to feel better for being more productive. So this is why I started to thinking about Chinese medicine, and saw a couple of them, and actually got really weird comments from one of the lady who told me that I need to eat a pound of rice every day and to make me having better reproductive system. And I felt very awful at that time with not just eating, but my stomach was feeling really weird. And I start thinking about, wow, back then when I just came to the United States from China, I was living with a Chinese woman, and she suggested me this float tank back in 2013. It's like 10 years almost, and that was already popular. It's called float tank. It's basically a deprivation tank. They put a lot of magnesium salt to make your body float, which is a really nice thing for a lot of people. That's really relaxing. I don't think it's really harmful for you unless you have some kind of connective tissue disorder and causing your joints really just cannot pull them up together. I did not know at that time I really had something called EDS, Ehlers-Danlos Syndrome. But I was just trying to feel better, and so I tried it out. I really liked it because as many of you guys know, that I am very big on meditation. So I was pretty much thinking that that was an amazing experience for being in the tank and meditating and relaxing and feel like you're back to your childhood, like your mom's belly. That's what they describe as. Until I got up, everything just felt a little wrong, because before I really relaxed in the tank, I felt really painful with my neck. I think it was really hyperextended backwards, and I wasn't really feel comfortable at the time. Eventually it relaxed and I thought it was fine. But after I got up and in the shower, and I started realizing that I couldn't hold my head up. And the funny thing is that after so many years with the mental health issues, I am so scared of being caught like having psychological issues again. And so, of course, I felt really wrong to mention that I did the deprivation tank that evoked those kind of symptoms. But it was very soon after I started having really weird drop attack. Like sort of people feel anxious and then they just suddenly drop on the ground. And that's how I felt like. And I felt like that was back to square one. So this is really have to go back a little bit more in time. I never thought I had any kind of mental issues growing up, but I did feel like it was a lot of symptoms. Weird symptoms like, why do I feel toothache after PE class? And I couldn't really eat my lunch, and I have to sit there and hold my jar, and which I didn't know at the time that was just TMJ. and that's another joint issue. When I was leaving China at the time, I was already developing a little bit of eating issues. So like I would suddenly eat a lot and I would feel uncomfortable and it felt really painful to the point I had to self-induce vomiting. And then I was being called like, maybe you have bulimia. And I was so scared that I have those kind of eating disorder. So I came here very actively. I started looking for treatment and looking for talking to professionals. And I'm sorry that I have to really adjust a little bit my head because my fusion is still really not quite healed yet. Back in 2012, I just came to the States. I started looking for psychotherapy, and second year I was actually called, maybe you have anxiety, that's why you will have such strong stomach issues, and I just take tons of Tums and didn't really help. And I actually had a car accident back in 2013. And I think that's when things started going wrong. Because I started having weird headache. Like, I don't know if it was migraine or what kind of headache, but I never really had a lot of headache before. So I started asking my husband, my boyfriend at the time, just continuously asking for Tylenol or for ibuprofen for just relief. And then I graduated from my master's, going to my doctoral program. And that's when things even got worse. I think it was stress because that's what everyone told you. And I actually lost a lot of weight. I was not able to hold down food. I was told that if I have a lot of stomach issues, I should go to a local, I should go to a GI doctor. And so we went through a endoscopy. And funny enough, after endoscopy, instead of me able to eat more because I was on a little bit of medication, but I was literally worse. I almost couldn't really hold down food, and I would wanting to have food so much and then feeling so bad. But fast forward 2015, I was already second year of DMA student. I was really happy about how me and my food relationship, everything just came back, but it was snowing and I went on campus and I slipped on the ice with my butt on the ground. And this doesn't really evoke any of significant symptoms, except now I'm looking back, I'm wondering, why do I even fall so much on campus, especially because there was witness of me almost every month falling on the ground, having my violin thrown out from me, and everyone was just really shocked and saying, are you okay? And I mean, I was a little scared, but I just never really put piece together. I will put everything on the table and let you see how messy of a picture of a map that is. So I didn't know, and I went on to 2017 with so much of behavioral health issues and the people that diagnose you with depression disorder. I went through several of inpatient treatment, and I think I didn't really talk as much about it before, but I did. I went inpatient even on my birthday, involuntarily. Funny enough that I had lost my memory for a couple of days, that I couldn't really put piece together why I wrote so many of Aka on a folder, because at the time I was in Aspen Music Festival wanting to play the next concert, but I couldn't. because I was in a psychiatric ward in Denver. After having medication for a couple months, I actually was worse. I went to inpatient. I was in a catatonic state, and doctors recognized that it was a so I know that doctor noticed that it was an allergic reaction for me to have this kind of such strong catatonic symptoms. And I was like talking very slow. That's why I guess I earned the name of a sloth, because it was my professor told me that if normal people talk like andante, then you're grave. Or like, it was just so funny in a way, that thinking back, me talking so slowly. But that was another roller coaster of mental health crisis. And I came out of it because I said, I'm gonna ground myself, I'm gonna meditate, and everything was fine. And my therapist at the time, doesn't matter if before or after, he's always rooted for me, and he always say that, no, you don't have bipolar. I just don't think you have it. And then he was right. So in 2020, when I went into emergency room because I fainted, I couldn't really wake up, and I was being diagnosed with a psychogenic seizure, or they said pseudo seizure. And I mean, yeah, the medical history on the chart with bipolar is definitely directed towards something psychological, because it's weird. They couldn't understand why do I faint. They couldn't understand why do I twitch on my left side of body, except I vividly remembering having a heavy meal before I start getting those fainting spell. And also, now looking back, I know my glucose was not right at the time, although I don't have Dexcom scan. I don't have a Dexcom monitoring of glucose, but I still know that it was because the glucose. It was such a obvious pattern and symptom that I can recognize immediately that which one is alike with some triggers. So it was back forth a lot of ER trips and with a lot of ambulance ride. The first time I was in the ER, I wasn't even twitching. But after 2 hours, they put me into a wheelchair because I fainted right when I got there. And I would say again, I just couldn't really help myself up. So I fainted in front of the nurse, and they put me into the wheelchair without any head support. And my head was hyperextended back, and it made me difficult to wake up, and it was really difficult time. Every time I wake up, I would tell my husband, I said, I'm in such amount of pain with my neck. And I'll fall back again and faint and wake up and repeat. Until they saw me, and my husband said, yeah, when you fainted, your right side, your hand was twitching. Like, I don't know why. So I really don't know why. Yeah, I was twitching on the right side. So of course I went back with the name of pseudo seizure, and again and again. And I was told that I needed to take medication for seizure, and I was told I have to get EEG. And so when I got my EEG at the University Hospital, I fainted again, and have what they call status epileptic seizure, but then they checked on EEG for 5 days. About 3 days, they take it off. They said, no, you don't have anything wrong. I don't think this is epileptic seizure, which is a great thing. You have a weird little some hyperintensity like on your skin, but that doesn't really do anything. I don't think it's really do anything. So we think it's just called PNES. Maybe when your body has a lot of trauma, you have mental trauma, anything that's psychological trauma that can cause you to have such an expression, which that expression makes me not understanding why every single time that was from the right side of my body. Yeah, and it's always from the right side, and it's always from right side having periodical paralysis. And that was just the end of 2020 to the beginning of 2021. It was so scary for a couple months for me to not understanding why my blood pressure would tank to 70s and low 30s. And the blood pressure almost gonna send people to emergency room, send me nowhere, because they said, well, yours are non-epileptic, so you wouldn't really have any life-threatening issues. ER to me became really useless. In the beginning of 2021, I am very lucky that I first sought out a lot of videos, and then I linked one of the PNES to one of the Ehlers-Danlos, to some girl who actually studies about EDS. And so I just learned maybe I do have EDS, because my beta score is literally 9 out of 9. And when everyone is telling you nothing's going on, especially in the end of 2020, I went to ER once, and the doctor literally, when I was about to wake up, I hear him talk to my husband, saying maybe she is just faking. Like, what? This is the first time I'm feeling so gaslighted and feeling like things are so wrong. Maybe that was not the first time, of course. Like, my stomach issue too. I went to the eating disorder facility and drinking those shakes, and it was making me feel so sick. I mean sick by everyone there, the patients. This is how messy I got. So that's why I really have my progression written down and right now in front to not make me really mess up anything. So I was really glad that I got something confirmed, because I said, oh, maybe, can I be hypermobile? And I had the clinician testing me and so scared of stretching my fingers, but I said, no, just go ahead. And so yes, everything was past the degree that of hypermobile. And so I had a Baden score of 9 on 9, and I was sent a referral to a geneticist to test further and getting a genetic panel of EDS, which there were 13 type, and if you are not the other severe type, then you are hypermobile, because that's kind of like one of these type that doesn't really have genes really classify that. Yeah, so I was diagnosed right around the time I got cleared out with my epileptic seizure. So I came out from ICU. They tell me everything's fine. There's nothing going on. Although I was like, what about my pulse? Because I also was feeling like, what about my faint is really due to those kind of heart rate issues. Because when I stand up, I did the same thing. I stood up from the bed from laying down. I did those kind of testing myself at home. Don't do that, but I just really can't wait till going to the doctors and being told that it was still normal. So it wasn't. Every time it was not normal. My heart rate would jump up like 30 or 40, like from 80 to like 130 something. It keep being staying up, and I was like, well, that might be it. So let's just going to a pod specialist, and you're lucky that you're still in metropolitan area, so you really have some resources. So I went to the cardiologist who is specialized in POTS POTS, so like postural orthostatic tachycardia syndrome, and the ER nurse call it, wow, it's like a millennium disease. So I don't know. They just don't really believe it. But I got tested, which I was so scared of that turned out not to be right. Those kind of anxiety provoking for going through those testing. And especially after you being told once over and over again, those are just in your head. And I was even being told by very close ones who telling me that I need to sort my head out and need to get basically mental health checked out instead of trying to figure out what's wrong with me physically. But now I'm looking back, I wasn't normal. After we were cleared that I had an EDS, I went to the clinic of the osteopathic doctor, and she's like, we need to get your body really aligned. And so after I got adjusted every single time, one thing did not go back right, which was my hip. It clunks, it sublocks, and it was painful to walk on. So I started to limp. I don't really know why, but throughout January, the beginning of 2021, until the mid-May, when I saw a paralysis specialist, because I wasn't really feeling right with my sacrum area, and my scan was showing that I have a lot of Tarlov cysts, like those nerve root cysts that filled with spinal fluid. So I was still kind of having a few of those seizures. One thing started getting weird is I will start having first a lot of pain in my hip, but also I have weakness and then spasms in my leg. So I went to see the child specialist, got a diagnostic injection to see if that was the root cause of everything. But the problem is that after I did my injection, everything went really well. I jumping up and down. I was not limping anymore. I felt great at the PT, and the fact that 7 hours later, my legs was filled with a lot of burning sensations, and I just was told that, wow, that's great, because that means the paralysis is the problem, from the group of paralysis Facebook group. I love those support group. They are really helpful. But what I didn't know is that this is beyond what they can really help me, because the doctor didn't really think, even the doctor was great, but the neurosurgeon didn't really think that I had anything wrong with my which called tethered cord syndrome, which means your spinal cord is tethered around the place that your spinal cord will end. So I was told that it was not that problem. But meanwhile, I saw a neurologist. So like now you slowly expand from one PCP, like your primary doctor, to about 10 specialists. And they dealt with your GI, and then I was told that I have mast cell activation syndrome, which causing a lot of allergies. And I was the one always telling people I have no allergies, and then suddenly realized that, wow, my postnasal drip always there, like I was coughing like a old smoker. And that was a constant allergic reaction to the environment, to the food, to everything. And so that was another comorbidity. And what else I can think about at the time, I also went to the orthopedic surgeon. This is when I finally was actually getting a right answer all along. He was telling me, you have something wrong on your right side, your whole entire right side. And he checked my neural signs, and he said, yeah, you have clonus, you have Hoffman sign, you have everything. So, your reflux is abnormal, and you need to see a neurosurgeon. There's something really wrong in your nodule, like your head, or something, And I was excited about seeing a neurosurgeon that he referred me to the university hospital, but they rejected it. They just sent me to one of those, what they call neurologist, and not other neurologists, but neuromuscular. Somehow I said I don't want to see a neuromuscular, but they never really do anything to help me until I actually have to get referral out of the neurologist, right? So I said, well, what neuromuscular? Well, but you have to rule out like ALS. Well, that's a scary thing. Okay, so let's do it. What I didn't know is once you get into those clinics, you can never get out or referred until they want to refer you. And if you back them, that might not happen either, because that's what happened to me. So I will go from all the way to my lower waist down paralysis to what happened on my upper body. As you guys know that I'm a professional violinist, and going through all that, I was like, I need to keep playing. I need to perform. I don't want to just stop normal life. So I still go in teaching and performing. While one of my leg, after the 2021 June MRI, trying to figure out the sacrum issues, I was laying on that MRI machine without any pillows under my knee, anything. And it was extremely excruciating pain. I was already having so much pain at the time with my sacrum. And after 30 minutes, I get up. I just kind of felt a little funky. And throughout that rest of the night, I gradually become weaker and weaker on the right side of my leg. And my husband started calling it like the dead leg, because, well, it just is so weak. It's like it's dead. I guess it's true. Like, nerve doesn't really go run down into it anymore. But of course, no one knows why my leg was so weak, and I wasn't getting any help at the time. And I said, I just can't really handle. I tried to start using a can. At the time, I was really focusing on dealing with my CSF leak, so I just couldn't really. I have a low pressure headache really bad, and my balance was so off. It was right after me taking a car trip to most the closest location for blood draw, but I was feeling something weird in my bum, like the car vibration and everything. And suddenly I was having such a bad headache, and I just couldn't really. I yeah, I was having a hard time. So after that, my balance was off. My inner ear balance was off. But again, I was told you cannot have a CSF leak by a neurosurgeon and telling me, oh, you just hypermobile. I might be hypermobile as well, and you just need to do some PT. I started doing PT, but PT was telling me your therapist was wrong. You cannot have the dissociation from turning one side of your head and then turning to the other side, because my eyesight was suddenly getting clear or blurry just by certain triggers that the PT was doing. I have no idea what he's doing, but it was clearly something physically wrong, not in my head. Again, into seeing an ENT doctor, telling her all these kind of symptoms that was tinnitus and almost having the hearing loss at the time. I'm sure I still do. And she was saying, no, that's not possible. You don't have a lumbar puncture. Like, alright, I guess it's not possible. Until I pushing through so many times, telling the doctor, the headache clinic, that I don't really think I have a migraine. I think I really have a leak. I don't know. I'm just keep pushing the idea of my symptoms because I documented it every single day at the time. That was a full-time job. I can do nothing but just documenting and contacting doctor and going to the appointment. And so I started to taking a pause on my program and not really working on my dissertation anymore. So yeah, I got my CSF leak fixed. I did a patch, and I did a patch in October. And it wasn't related to my paralysis, because my paralysis started first in June. And knowing that I couldn't really hold on to walking, I feel like I really need to ask for a better wheelchair. My wheelchair was cumbersome. It was so heavy that I cannot lift it myself, even at the time I have strength on my upper body. So I finally got an appointment. It was 4 months away. 4-month wait for a wheelchair evaluation, only to evaluate that you need a wheelchair, not to get a wheelchair. So yeah, so I was basically having one leg paralyzed going to clinic, but didn't notice that my left side also was getting weaker. And not even till October, I realized that I was having so much pain walking. I was using a rollator at the time, and my best friend has to come to campus and save me from not able to walk from the library, which is just across the street, to where I park. And I will be having so much pain and so much pause that I end up sitting on the roller and tell my best friend, I said, just push me, please. I can't. So October comes and they still haven't figured out anything. I went to another neurologist and she was so worried. Things are so all over the place, and the sensation, the vibration, everything. You better go to a better hospital. But I'm like, I have another concert, I have to go through the concert. So it's funny enough that I didn't follow what the doctor said, and so I went on to doing more gigs. But what about 2 legs paralyzed? Well, I asked for the wheelchair, and I asked for loaner wheelchair that is light and easier to transport. And I also got my hand control. I don't know if it's just me being resourceful or me being stubborn that I just want to keep my job. I just want to keep playing. I I, I love the fact that I'm performing still on stage. I don't care if I go up to stage with my wheelchair and transferring to the normal chair. People will see it, but I feel like that was a great representation of how people with disability might be. Because apparently, after June, I cannot hide my disability anymore. It become visible. Many people that are ambulatory wheelchair user, I was when I was in January, that when I was in January, the beginning of 2021, when I just had a lot of POTS episodes and feel faint. But now I am paralyzed. Well, I was already diagnosed paralyzed, figuring out a few conditions that was really actually physical, like my mouth. Like there was something, the ligaments was hypertrophic and dangling down, hurting all the nerves. And that's why I was having so much trouble eating. I lost a lot of weight again. And this time, no, it was not eating disorder. And then we go on to December. As I already know, something was really wrong. And one of the pain management doctors said, I don't think it's FND. You're too calm. Like, I think, can it be tetracord? Can I refer you to a neurosurgeon? And I did. And then I actually was told there was no tetracord. But continuous research, continuous watching conference about EDS was really helpful for me to finally get to the road of the right provider. So I reached out to a tetracord specialist, a neurosurgeon in Rhode Island, and I did my first solo trip with wheelchair. Not the one that was car, but fly. And everyone was so scared, and I was like, I'm gonna figure it out. But I was really having fun at the time because I really had still all the strength on my upper body. And by the time I see the so basically October I lost my left leg, and December when I went to a called Ability Expo, I feel like I stretched my body too much with the climbing thing, free climb. And then suddenly that morning, I just lost my hip. I couldn't really lift up my hip. That's kind of how I felt. And it was so scary, but it was also, like I said, why do you even go to ER if they don't figure out what's going on? Things are always going to be normal. You know that because you had so many MRI scans. And they always say it's within normal limits. And then you keep creeping into that picture, you try to read and try to understand, and then you still think they said it's normal, so you shouldn't feel this way. And 20 days later, after I drive so much, going to so many performances, and after I did a fitness class that is adaptive, so that means like I have to lean back down, and push myself back up so many times. And I thought, wow, that's great. Like I did a workout. But I didn't know the second day morning, I woke up and I said, I cannot really feel the chest down. Like I cannot really feel that I can move, I can lift myself up anymore. So from that point on, my sensation was changed from nipple down, and my strength also lost. So that is really the first part of onset paralysis. Every time was onset sudden, but no one really seemed to want to do anything. And I only had a really good doctor who looked at my leg, and suddenly I have spasm. And she looked at it, she kind of started concerned. She said, I need to refer you to a I should refer you to a specialist, a spinal cord injury specialist that she knows. She knows how to diagnose you, or she needs to figure it out because you probably have a spinal cord injury. And then 2022, yes, I went on my solo trip and I met the surgeon, and the surgeon said, yeah, that's right, you have spinal bifida oculta. I have an infused spine at the bottom of lumbar and sacrum. And it was there, it was on the scan. I was excited, that's why I contacted this neurosurgeon. And she said, you have to figure out how to rule out everything else. So I was like, all right, that's my task. I will do it as soon as possible. But the as soon as possible lasts 6 more months, more than 6 more months. The reason is all because they really don't want to do testing in the ER. They think that I'm fine and I'm getting a functional neurological disorder diagnosis. And I somehow agreed with seeing a specialist with it, but although I just don't really think that's my problem. Now, the second part is really starting to getting worse. 然后呢？好了，前头多少没了？前头多少没了？
没多少，没了呀。我那有暂停一下再有，省得一定跳脱来。
哦，OK。然后，搿样我就晓得我前头没多讲太多。So where are we now? We are literally having halfway, because it's not just happened one at a time. Of course, I was having issues with my upper body as well. Because the beginning of finding out the problem was my right side of weakness, a slightly weaker grip. But the slightly weaker grip, when I went to an OT, working on it, just like the PT, the more I work on it, the worse it gets. And I don't know if it's because what we worked on, or just because the problem was never found. And I went to, so that was me trying to figure out everything, grew out from ALS to possibly something immunology related, like with my spinal fluid inflammation, things like that, MS. But after I saw, but actually I was still getting weaker at the same time. After I saw the neurosurgeon, I came home and I had a great experience with PA. The PA was very nice, and she took down all the history and yeah. after she took down all these history, and she was told that I was told that I will be able to see the neurologist finally again after a year, actually almost 5 months of wait. And I have appointment a month later, but I do have to do a lot of other tests as well. So by the time I actually had my MRI, just normal MRI, I was suddenly having weakness in my right side of hand, that this hand is no longer able to open up. I didn't know why. I was just really kind of worried, but also feel like that's just another progression. I still can do everything myself. I still can lift my chair out of my car. I still can go to the school where I teach, and I still can play the whole concert with the symphony orchestra. So I must be fine, just like they said. So March, I saw the neuromuscular doctor. Sure, it was all right. He took me seriously, but we have to do testing. The tests come out somewhat within normal limits again. Everyone at this point knowing that tests are always going to come back normal, right? And it was normal, and I was told, no, I was not told. I didn't even see the doctor first. I had a resident come in the door. Doesn't really bring on all the history or anything. He just started asking me weird questions. And so by the time he said, oh, how does that disability affect you, your life, or your emotional? I was like, I don't know, like I'm still playing. And so I showed myself playing in my wheelchair, and he didn't comment on it. Well, whatever he thought was showing in that office notes clearly, but he didn't say anything at the moment. And he asked me again, oh, so how do you think about F&D? What do you mean, how do I think about? I only have one doctor. I wish I didn't say that. So I basically said, yeah, I have one doctor said maybe F&D, but then like he said, well, no, like it's not possible. Well, he took that for granted, definitely. And then he was asking me, how do you feel about this diagnosis? I was like, no. This is like, I just feel really, I'm not, definitely not like having a psychological issues and stuff. Like I tried to go that route because I wanted them to understand that I'm not saying that I don't believe in F&D always, but I do want people to kind of see me as like I don't really have any psychological issues to put the label on, please. But yeah, he still did, and he ignored my upper motor neuron sign, all these hyperreflexia, but yeah, he put F&D, and they came in and they like, at the worst time ever I can be, I was kind of groggy, and I was definitely on a new meds and feeling so sedated-ish. And so the doctor came in and said, oh yeah, let's evaluate more in the movement disorder clinic so they can evaluate you for F&D. I'm just like, I don't think it's that. Well, your scan comes back normal, your tests come back normal, so what else it can be? Well, January I had a prior MRI. My extension flexion shows some of the edema, but they don't really look at the scan for upright, and they think their job's done, so they moved on. And I had to move on because I had a stomach surgery for mouth. So the second part of onset really happened after I did my mouth surgery, because my lower half is even weaker. So when my husband transferred me, and when I was doing my own task, my upper body just isn't really strong and hold together. So every time I have an MRI, I have an MRI. So every time I have a MRI, I was suddenly having paralysis on something, like something got weaker. And the crazy thing is that when we transferred, and I suddenly, after that day or two, my left side of hand, so both of my hand are not able to open up. And at this time, my arms also getting weaker, and I having a hard time to push my wheelchair up to the ramp. And so we decided this is the time, because I told my neurosurgeon, I said, I'm gonna jump into it. And she said, what do you mean jump into it? I said, into the ER, because, well, we're gonna push them to do the test if they don't really do it. And they did it. And so I had to really do that. I went to the ER, but nothing happened. And again, 2:30 in the morning, 3 in the morning, we are coming back home with nothing. Only the neuro evaluation. The lady came in, asked me to lift up my arm. My right side wasn't able to, but my left side still having tiny little bit up. And she's like, well, we don't do the lumbar puncture in the ER setting. And so, well, you're gonna schedule with that doctor to do outpatient. I'm like, if you admit me, I wouldn't be doing that. No, let's just wait. So unfortunately, I have to wait till literally 2 months later, seeing the neuroimmunology doctor, and went into the room, having the lady just said, I don't really know why you're here. Like, why? Because I really have to rule out everything. And so really by the time in August that I got everything ruled out, I had my urodynamic study that proving that I have neurogenic bladder. At the time, I already have to cathing myself and do bowel program, and I was classified as a C4 incomplete quadriplegia, and I was still having no result, nothing showed up abnormal. So in September, I was told that I cannot really see the doctor virtually to figure out the surgery. We really have to go in person again. So I said, okay, December, that's another 6 months of wait. And by the time I was already almost a year and 3 months into my paralysis journey. Yeah, so it's a constant chronic issue, and it's just getting worse and worse. And you're like frog, like slowly boiled, and you don't even notice it. And I was at that point thinking, I cannot do this anymore by myself, living almost on my own for the majority of the day, because I was hurting. I came home from teaching, my arm was just so fatigued. They were so painful. I don't even know if it was nerve pain or just muscle fatigue, and the muscle was giving out. October 14, 2022. That was the last time I was able to shrug my shoulder, or I was able to have a deep breath. I got really good at deep breathing. May 2022, when I just had my surgery, and I was practicing it and noticing how much I was able to breathe after I don't have those nerve pain. And it was amazing. And then 4 months later, it all took away. And I couldn't lift my arm. I couldn't shrug my shoulder. When I was laying on the bed, I almost panicked because I couldn't breathe. I felt like my chest was just so heavy and nothing was able to lift up, and I feel like I was drowning. I told one of the media that I shouldn't use the word drowning because it wasn't the right feeling. It was feeling the heaviness. But now every time I talk about it, I just still use the word drowning. It felt like I couldn't breathe. But let's just keep going, right? I have more concert. I can just keep going. I can keep pushing through it. And all these onset paralysis I didn't notice. All of a sudden, I become a C1 incomplete quadriplegic. Not only that, the amount of weakness I had, it was classified as motor complete. Many of people on social media have told me, no, they argue about you're not motor complete, you can still lift up your arm. I'm not talking about this. I'm talking about on the exam table, laying down supine, unable to use your arm, lift your arm, move your arm or fingers. Nothing. But what does the doctor do? They said, we don't know what's going on. And you need a power wheelchair. You need a power assist. Let's call it FND. Because, we ruled out everything. I'm like, no. What about tether cord? I still have to figure out my neck. Well, we already did all the tests. So let's just call it, and it's fine. But I didn't know it was not fine because then the doctor was using that diagnosis over and over, using different words, and it's hard for me to get care, especially my breathing. Alright, finally, 2023 arrived, and I was able to travel alone again. I didn't know how to figure out everything because I couldn't really transfer onto the bed anymore, but I can ask for help, right? So I still went on to trips by myself, and I went to Rhode Island, and I was there all by myself, and I figured out a way to even get on bed and filmed it and put it on Instagram and show people that I can be independent in a way that ask for help and trying to figure out myself. And I was told that let's do surgery. So I begged the doctor to just the neurologist. I said, well, maybe I need a clearance or something. They don't want to see me, and they offered me a neuroconduction study again, and I did it, and it was the worst exam ever, not because of the pain I would go through like with my body, but the amount of gaslighting and dismissal, and the way that the doctor's bedside manner was just so horribly wrong. He was telling me my spastic legs to just calm down, and I looked at him as he said, calm down, lady, young lady. I guess I don't know, like it was a compliment. I I was not able to. I begged. I said, can you just please lift up my knee? And that's how it can really reduce the amount of spasticity. And he refused. He literally just ignored. I didn't get any help. And finally, the legs start getting more and more calm, and they wasn't moving before they did EMG. So they put needle in there and see if your muscle has those kind of fasciculation, testing those peripheral things. But they know what happened with a nerve condition study, it was not right. So when the resident tested and the attending comes in, and he was just sort of angry. He was like, oh, something is wrong and I need to test again at the back of your knee. And just test it again and again. And finally, he agreed that there was something wrong. And then so he started blaming. He said, oh, you sitting in a wheelchair. Did you noticing that your back of your knee, maybe it's hitting something. That's why it cut the circulation. I was like, really? I don't know. I don't think so. Maybe. And then he went on to EMG test, and I didn't really move or anything, and because I couldn't. And he turned around and he get to the computer and he start typing, and he think, well, she might just be emotional. And at that moment, I didn't know what to say. Although sometimes I can look really much like a great advocate for myself, but often I feel a little scared. I don't want to say anything. I don't know what to say. What do you mean emotional? Like, I'm not. Like, I don't want to be offensive. So I didn't say anything. And they went on, and test came out. The test came out abnormal. I was excited about abnormal, and it showed on the test result. It says it's central process or yeah, he said or submaximal effort. What do you mean submaximal effort? And I went on to my osteopathic doctor, and funny enough, he said, oh yeah, that means like you're just faking. I'm like, again, I'm not faking. Come on, just stop doing this to me. And I went on to surgery, of course, and I always feel like I have to getting second approval that this thing is the right thing to do. And even right before my surgery, I still doubt myself because they said it was nothing wrong. So what if I came out with surgery and I was told like there was nothing wrong in there? And I look at my husband and he looked at me like you're insane, like you're already here and your doctor think that you do have issues. But yeah, I don't know if it's luck or it's just because we are pretty rare and the condition isn't really shown on MRI. I end up having really a tethered spinal cord. The thing was showed tight. What else did she need to show? I mean, it was funny enough that my surgeon even was surprised. She came out, she was really excited and tell my husband the news. I was still sleeping. She said, "Whoa, yeah, it is tethered cord." And so my husband also got excited because, after so many gaslighting, the way that if it is not tethered cord, I think it will break his heart and thinking that, what are we doing all along? And seeking for an answer that it's not there. It's just in your head. But this is a proof. This is a great proof. The first one that telling me I need to trust myself more. So a month later, I went to South Carolina and I saw another neurosurgeon and I was told, you're C4 and 6. there. It's definitely having a lot of stretch, and there's no way that there's no spinal fluid flow, and there's no way that you're able to move your leg. And there's edema coming out from that appointment. For me, was so enlightening, because I almost felt like I was not able to even pursue my dissertation on the topic of what I want to talk about of my paralysis. Because what if it's just in your head? I can't really work on that. I cannot talk about a brain to body function disease, and that I can play because you can play. There's always a way that it's inconsistent. That's why you're able to play. So that was a really good confirmation for me to know that there was edema, that there was a structural issue. But what happened when I come back to Texas, I was again told nothing wrong. The neurosurgeon who doesn't really want to work with you or didn't know how to help you, they often, behind a closed door, they often would say, there was nothing wrong, there was no stenosis. I don't know, you're always going to get worse if you age, I hate this. I don't really know what to do next. No one was trusting me. So at that point, I was really ditching all the neurosurgeons in Texas. I know something was wrong. I'm going to hold on to it. And so I went to the inpatient because another spinal fluid leak. And the funny thing enough, I didn't really think about is every time I play, I brought my violin to the unit and I practiced. And then I was playing some izai, maybe it was a little bit aggressive movement again. Every time was izai. I don't know why. But every time I play izai or practiced, and after that, I was sort of normal for a couple hours. But then I started having so much issues, pain, suboccipital. I was having the headache. I was then just feeling fainting. I don't know why. And all of a sudden I start spasming for 3 hours. And that comes with dysphagia. That comes with weakness on my right side. And I couldn't really using a normal straw. And it's just so much going on until I was able to see my current neurosurgeon. So this is when I also did my research, and I know at that point on my measurement of my occipital, suboccipital, at the front of my C0 to C1 was just very off, and the movement was way too much. It's insane to not notice, but radiologists still say it's normal. There was also another test. I already know that so many things are abnormal. There's no way. I went on a trip. So I went on a trip to see the neurosurgeon by myself again with power wheelchair. I thought everything would be fine, but even before I leaving, I started to faint every time I used the bathroom. So the trip, maybe it was hinted that it would never come as smooth as it was, but you also feel like you have to say you're lucky enough that you fainted in the neurosurgeon's office, because otherwise how they would see all these symptoms, the crazy symptoms that you just wasn't showing them when you were talking during the consultation. So my glucose was roller coastering, and I was spastic. They call it dystonia. And then now looking back, I understood those crazy seizures that even involves facial issues like those spastic movement in the face. Those are dystonic storm because I was fully conscious and I was fully awake, but I wasn't able to respond. Where was the wrong? Where was going on? Where did things go wrong? Was that spinal cord? Yeah, but also brainstem. They forget brainstem because I don't know, like that's the things like last thing they really go to. Well, especially the lower medullary area, medulla. So the pons, the medulla. So the medulla really was the last place of your brain that the MRI that gonna go to. And can you see really right now at this point the scan, the MRI is advanced enough? I mean, maybe I have no right to question about these because I have no medical degree, but I want to bring this to the table as everyone start thinking, what went wrong for the whole entire 3 years that although you have a spinal cord injury, but no one is going to do anything. Although you have a spinal cord injury that no one's believing you. Everyone having spinal cord injury with a car accident or anything that is traumatic, a fall, they immediately had decompression. They immediately had fusion. But us, it was repetitive, harmful compression and small minor traumas. So I got my surgery just about 2 months ago. And I had my fusion from skull to neck. And I also had my front of C4 to 6 fusion. Now I can be considered as getting saved, I guess. One part I didn't mention is that right before I had my surgery, I actually had a really scary moment. I feel like I might just be lucky, but very unlucky. In fact, I was hitting my spinal cord and the brainstem from the front, the anterior side. So I didn't really feel that much of vertigo or craziness of nausea, like I couldn't really hold down food. No, but there was really severe things, like I had my right side weakness and went to the ER, and I was with the caller, and somehow now looking back at the notes, it makes sense. They said with distraction, they trying to do distraction, but no, it doesn't work with my eyes. But they still decided to call it FND and saying that you just need to see a counselor doing CBT, which probably isn't right. I know about FND. I know real FND doesn't really just needing that. Or doctors saying delay clonus, things like that. But I'm so glad at the end of the road, I really decided to take the surgery earlier because I literally hurt my brainstem once again, further and more damaged. I know there are a lot of amazing stories to tell with all these interviews, and I really wanted to just make my story as precise as possible to give you an overview of this little glimpse of my life and how the misdiagnosis or the delay of treatment, the delay of even confirming something was wrong, that has such big price on me. I mean, it's okay that right now sitting here I am a C1 incomplete quadriplegic. It's okay that I have so much of damage to my spring stem that I don't really know one day that will come back. Well, at least one thing I'm sure, that I can still play my violin, and I really, really appreciate that, because you know how important violin to me is. So I'm so glad that I was continue playing, but I don't know if I ever took a step saying, let's take a pause and figure out what's going on, and that would change the course of action, that would change an early diagnosis, early finding of me having C1 dislocation, or I have C1-2 subluxations and all that. It will be sooner. It wouldn't be more than 18 months long, or it would be somehow giving me my independence back, that I don't need to be in the power wheelchair, or I am able to propel my manual wheelchair and doing my wheelie again, and I can be independently just driving a normal vehicle with hand control. Would that be really any different? I don't know. But I am so glad to be here to tell you my story, so that way you might not be taking as long of a time to figure out, but who knows? The health system is the one that needs change, and I think so. Many of others think so, and right now, this is a very much shortened version of all the details I could have tell of a story of my journey of finding out I have CCI, AAI, and I have EDS. I had literally so much damage to my brainstem and spinal cord, and two things happened at once. My lower spine tethered, and it was getting stretched, and it got damaged. I want to probably have a machine, a MRI, technology that is able to really show everyone what was wrong. Because yes, it's occult, but it's in your body. Something is happening, and it's just current science couldn't see it. So that doesn't mean it's in our head, or that doesn't mean it's functional. That doesn't mean that we can be diagnosed, we can be treated, we can be getting the care we need, and what is wrong with the health system. So this is where the occult awareness comes. I know this might be such a long episode, but you will hear a lot of long episode, and this is the reason why. I think without having long conversations and getting comfortable with each other, and letting your brain, just your heart, to open up and to just talk naturally about what you are thinking. We always guarded with certain words, certain thoughts, and I don't want this one become so filtered. but I do wanted to have the health professionals, the people who have the knowledge, have the public health knowledge, have different aspects like F&D come to the show to talk about this really global pandemic issue, as so many people having symptoms, having possible conditions like EDS, like CCI, like AAI, but cannot really just be diagnosed, or really wrongly diagnosed, misdiagnosed, as we say. And what do we do now? What can we do for these people? And they are just getting sicker. And why does that not having enough fundings for brainstem studies? Why there isn't really enough research about brainstem? So at this point, at the end of the first episode, very first pilot episode of a cold condition, I want to bring my story to the light. I know it might be really long. You can skip all that until the end, and you can just hear me talk about how my real thoughts after 3 years going through those medical traumas. One thing I always felt like is I didn't really become the victim of these gaslighting. Instead, I felt like my traumatization become the righteousness to make this episode, to make this podcast as a way to really openly talk about these issues, and having more knowledge for everyone else to have more knowledge, to open up, to stand up for yourself, and to start questioning whether or not my diagnosis is legit. So yeah, this is the first episode. I hope you guys really learned through my journey. So we're at the end of the episode. I would love to have you keep fighting for the answer and gaining more knowledge about your diseases. And don't forget to visit our website at thrivestrive.com/occult awareness. I do think there was a dash to really access resources and read more about these topics, and also support our mission. If you found this episode in any way enlightening you, please consider subscribing to our podcast on your favorite platform and leaving us a review. And your feedback really will help us grow and reach more listeners. Follow us also on social media at occult awareness with _ to stay connected and informed about our upcoming episode. And also remember, your story matters, your health matters, and you are not alone in this journey. Until next time, keep striving for knowledge and awareness. Bye.